Thank you, Professor Dada, invite me here. My name is Xiulan Zhang, came from Zhongshan Ophthalmic Center. I would like to present MIGS for PACG. I don't have financial disclosure. PACG is a majority of our patients from Asia Pacific area. PACG's angle is narrow or close. You will see part of the angle open or totally closed. Trabeculectomy or phacotrabeculectomy are first choice for advanced PACG. However, both are not ideal surgery. On the other side, almost all the MIGS are aimed for the POAG in the very beginning and for the earlier moderate stage of glaucoma. Can MIGS be used in PACG at advanced stage? I would like to take internal trabeculectomy, also called goniotomy GT, for example, to discuss related issue. 20 years ago, the PEIs laid the foundation for MIGS. And the GSL reopened angle paved the way for internal MIGS in PACG. And goniotomy removed the dysfunctional trabecular meshwork and enhanced the aqueous humor outflow. There is new combination surgery. PEI+GSL+GT should work well for advanced PACG with cataract. Indeed, PEI can solve shallow anterior chamber, GSL can solve PAS, and GT can solve dysfunctional trabecular meshwork. Two multicenter studies confirmed that 120-degree GT alone or combined with PEI is enough for POAG when compare 120-degree, 240-degree, and 300-degree with or without PEI. That is, 120-degree GT is enough. We use 120-degree GSL combined with PEI and GT to compare advanced PACG with different synechia range and found there is no significant difference of surgical outcomes. That is, 120-degree GSL is enough. This picture shows you how to do this new combination surgery. PEI first, and then under the gonio lens, you will see the angle totally close, and then 110-degree GSL, and then 110-degree GT. The procedure is simple, quick, and less complications. I will show you videos after my talk. We have published half-year, 1 year, and the 3-year surgical outcome. 3 years results is on the way to publish. Look at the IOP reduction and the complete and qualified success rate are all great. Multicenter non-inferiority RCT to compare phacogoniotomy versus phacotrabeculectomy for advanced PACG with cataract. 1 year result already published in APJO, and the 2-year result is on the way to publish. And the results show phacogoniotomy is non-inferiority to phacotrabeculectomy. And the phacogoniotomy has less complications, less time consuming, less cost, and more improvement in quality of life. For advanced PACG without cataract, there is another new surgical combination. SPI+GSL+GT, SPI first, and then 120-degree GSL, and then 120-degree GT. The procedure is also simple, quick, and less complications. I will show you the videos after my talk too. The same SPI+GSL+GT should work well for advanced PACG without cataract. In fact, SPI can solve shallow anterior chamber. The other two are the same as mentioned about. We also publish half-year and 1-year surgical outcomes. 2-year result will be published soon. Great IOP reduction and good codified success rate, and has similar complete success rate with trabeculectomy. The RCT to compare SPI+GSL+GT versus trabeculectomy we finish 1-year follow-up. The result already submitted to JAMA Ophthalmology. It shows that SPI+GSL+GT was not inferior to trabeculectomy. The new combination surgeries are also effective to treat peripheral glaucoma. I will show you the video too. Another MIGS can work well for PACG through PEI or combined GSL, such as PEI+GSL plus trabeculectomy plus iStent or even Zhang. So based on above studies, we believe that the new combination surgery can bring new option or new innovation in PACG. SPI+GSL+GT can replace trabeculectomy. PEI+GSL+GT can replace PEI+Trabeculectomy, that is phacotrabeculectomy. And we hope one day in the future, they can adopt into consensus or guidelines. Thanks all the wonderful experts support and guide us, and all the members of our multicenter studies group follow me several years. You can watch more than 240 surgical videos from my booth through the website or through the YouTube. The wonderful instruments, including synechiolysis and the microhood, are available through the websites or QR code. So let me summarize. MIGS bring new option for the treatment of glaucoma. At present, MIGS is mainly used in open-angle glaucoma. In growing evidence showed that the MIGS can be used in PACG, and 2 RCTs are expected to bring new option for PACG. The future trends for PACG is revolutionizing. Trabeculectomy and the phacotrabeculectomy would be replaced. Of course, this presentation only represents personal point of my view. Let me show you 4 videos. Thank you very much.